Hey everyone, my name is Darien. So I am the current treasurer and fundraising chair here at the Student Nurses Association chapter at GW, and I'm here with Dr. Lang. Do you want to introduce yourself?
Yeah, of course. Hello, everybody. My name is Dr. Carol Lang. I've been a nurse for almost 40 years, teaching here at GW University for 16 years. And my nursing has been primarily comprised of flight trauma nursing, and I'm also a psychiatric nurse practitioner. And I also have a background in ER and critical care nursing, as well as community and international nursing. So very, very varied background.
Yeah, definitely very background and very experienced too. So, to talk a little bit about flight nursing for those who may not know, could you help explain what flight nursing is exactly?
Yeah, of course. So flight nursing is a very, very defined, very narrow career in nursing. So to be a flight nurse, you have to be a very highly trained, very experienced registered nurse who specializes in medical transportation. And that medical transportation could be trauma, high acuity type of nursing where you are responding to medical emergencies in a trauma setting. That could be at the side of a highway, at the ocean, out in a rural area, or it could be transporting the patients from one area, let's say for example a small rural hospital, to a level 1 or level 2 trauma center because they need a higher level of care.
Wow, that's very intense. So I'm assuming in order to even get that job, as you mentioned, it already takes a great deal of experience as being a nurse to even become a flight nurse.
Yeah, so the experience is generally about 3 to 5 years, probably not as much as you would think, but 3 to 5 years working as an emergency room nurse or as an ICU nurse. So that's the most common background that nurses have. So if somebody's been a medical surgical nurse for about 10 years, they won't necessarily have that exposure to working with trauma patients or working with ventilators, which is very important. So about 3 to 5 years experience, generally in trauma or in a intensive care unit.
Wow, that's very interesting. So, with you being a flight nurse, how many years of experience did you have being a flight nurse?
So, well, I was working as an emergency room nurse just for 3 years before I became a flight nurse. So I had that 3 years experience but it was a level 1 trauma center. Level 1 trauma is the highest level of trauma care. And also in the hospital that I started out in, that particular hospital also had a flight program. So we had a
Wow.
medical transport program. So it was a very large teaching hospital.
Wow. Okay. So, on an average day of being a flight nurse, could you let us know what's going on? Is there a lot of calls? Is there a lot of patients, or what would you expect through
Yeah.
a normal day today?
So that's a great question. Of course, it varies, just like any emergency department, although it's different. In the emergency department, we can usually anticipate that we're going to see anything between 500 to 1,000 patients a day. If it's a small community emergency department, we could anticipate 150 to 300 patients a day. As a flight trauma nurse, you really don't know, but in general, over a 12 or 16-hour shift, you may have about 3 to 6 patients, or you may not have any. It's highly unpredictable. We really just don't know how many patients are coming in. It can depend also on the weather, on weather conditions. So for example, in the winter, it could be incredibly busy during the winter months, or if we have weather where there's a tornado or there's a hurricane. Can also depend on other factors such as the number of people that may be involved in the type of emergency. So we may be going back and forth to the same spot repeatedly. But again, it's about generally 12 to 16-hour shifts. But you have to remember, as a flight nurse, that you are always on. You have this long downtime, but you're on, because within minutes you have to be able to jump up and be very focused and be in the air and be on your way to the next patient.
Yeah, and also, it's also making more sense now when you mention you being an ER nurse to being a flight nurse, because you talked about how unpredictable things could be. And I know with being an ER nurse, it's every day is unpredictable. You don't know what you're going to get, so that brings a good light into it. So what would you say was one of your like what would you say was one of your most hardest moments of being a flight nurse?
I think the hardest part of being the flight nurse is the unpredictability of it. And I think also the unpredictable environment that you're working in. So when you're working in the emergency department, or you're working in the ICU, or you're working in the medical surgical unit, everything is very controlled in that environment. You have a lot of people that you can depend on. Being a flight nurse, there's really only you and a very small team. So for example, on a helicopter, it may be you, a paramedic, plus a pilot. If you're working on a small plane where you're doing medical transport, say from a rural hospital to a large trauma center, because the patient requires a higher level of care, then that may involve a bigger team, which could be, of course, maybe 1 or 2 RNs, could even be 3 RNs. Often a medical provider, which could be a pediatrician if it's a child involved. It could be a critical care physician, depending on the level of the patient. If the patient is on a ventilator, we may have a respiratory therapist on that team. We'll generally have a paramedic with us, as well as a pilot. And often the pilots are also paramedics, or they could be nurses, and they just happen to have a pilot license. But going back to your question about what's the hardest part, I do think it's that you're really in that, you don't have a controlled environment. Again, it's not like an emergency department where you have this large team and all of these resources. You have whatever you have on that aircraft, again, whether that's a small plane or whether you're on a helicopter. I think the other hardest part of the job, I think, is sometimes having to make very large decisions or big decisions on your own. So that's kind of the best part of the job is the autonomy, but you do have to make some decisions right there and then without any provider that's available. So typically on a helicopter, it would be the flight nurse, it would be a paramedic, and a pilot. So usually there are 3 of us. Again, it depends on the size of the air transportation, and the type of trauma that you're going to, and how many people are needed. But generally on a helicopter, there would be maybe 3 of us, possibly 4. And again, that all of us rely very, very heavily on each other because we're such a small team. We don't have all of the resources. So you have to be able to think on your feet and be able to work within those limited resources.
Yeah, and that's very important in a moment like that with a small team and limited resources. Teamwork is very crucial and important.
Yeah.
So nursing is a field that, of course, it's hard work and sometimes there's hard moments, but there's also very rewarding and very good parts. Can you tell me about some of the best parts of flight nursing?
Yeah. Okay, I think the best parts are probably, I can talk about those for hours. I mean, because there's some great parts. There are some parts, as I just mentioned, that can be very challenging, I think, for any nurse. The best part is that I am using all of the skills. It's the highest level of nursing, in my opinion, that you're using all of the skills and you're working at your absolute highest level that you possibly can. I think the impact that you have on patients is one of the best parts. You're working with patients who are likely having the worst day of their lives. And I think it's so meaningful that you're able to almost bring all of your ICU skills, all of your ER skills to be able to help them. They're so reliant on you, and it's just you and your team. So I think that's one of the best parts of the job. I think the other part is the independence that you have. Again, there's that great autonomy. You're really able to think on your feet, put all of those skills into action. So I think that's another best part of the job. The other part, I think, is being part of this amazing team. So we all rely very heavily on each other in that team, just as you would if you work on a medical surgical unit, if you're working in the emergency department, you all are part of that team. But the bond that a flight team has is a bond like I've never experienced. It really is like no other bond I've ever experienced in my professional career.
Wow, that's amazing. That's honestly amazing. So I'm sure there are a lot of student nurses who are watching and possibly also current nurses who have the desire to eventually become a flight nurse. And once they do get the opportunity to become a flight nurse, what are some things you feel would make them a successful flight nurse?
Okay, that's really a great question. So to be a successful flight nurse, it really is going to start at the beginning of your career. You sort of have this idea that that's what you want to do. That's why I went into nursing, was to be a flight trauma nurse. I really wanted to do that. So, but had to have those years of experience. So getting 3 to 5 years experience in the ICU or in the emergency department, that's typically the way in. Volunteer for the most difficult patients, the most challenging patients. Instead of avoiding the most difficult patients, you want to volunteer and say, wow, that's a really tough case, I will take that case. I think becoming very familiar with ventilators, with hemodynamics, with all of the IV drips, with medications, with ACLS, advanced critical life support, advanced cardiac life support, and then PALS, which is the pediatric advanced life support. Having those certifications, very important also. It can be very, very competitive to get in because we don't have that many. We may have 100 nurses working in the ER, we may have 100 nurses in critical care, but the flight teams are generally very small. So, but flight nurses often won't stay for long periods of time. You generally don't have a 26-year career as a flight nurse because it can be extremely demanding physically and mentally. So you do need to have a lot of resilience. So the interviews for flight nursing, I think once you have that 3 to 5 years experience, once you become very familiar, very confident in your assessment skills, and also with ventilators, you feel very comfortable, you've taken ACLS, you have the PALS certification. Once you have all of those certifications, and if possible, try to work in a hospital that has a flight team. So there may be an opportunity to shadow them, and then you'll see whether this is a good fit for you or not. But the interview process can be, I think that was probably the most daunting part of it. So the interview process, because you may have 50 nurses all applying, not just in your hospital, just being in the hospital doesn't mean that you may have a slightly better chance, but they are really looking at your clinical skills, at your critical thinking skills. Can you think on your feet? And part of that interview process, they will give you a major case study. So they will say, what would you do in this situation? How would you prioritize? How would you triage once you land? And you don't have any idea what they're going to ask you. So I think that was probably the most daunting part of that interview, because they're not necessarily concerned that you've got 10 years experience in the emergency department or 10 years experience in ICU. It's more, can you think on your feet? How they're listening to how you respond to these questions, and they're looking at your anxiety level as you're responding. Because if you're in an interview and you're sort of becoming very anxious in that interview and trying to figure out how to respond to this case study that they've given you, and this trauma scenario they've given you, then how are you going to be able to think on your feet and use all of that critical thinking and all of your nursing judgment? Again, things are very unpredictable. You don't really have those resources to check with somebody else and say, hey, what would you do? You are the one who's making the decision, so the buck stops with you, and somebody's life is depending on you. So it's very, very different. So it's really also taking good care of yourself physically and mentally. That's going to be very, very important. Working out, running, kind of finding ways to burn off a lot of the stress. It's very, very physically demanding, but it's also going to be very emotionally demanding to work as a flight nurse. So it's and you're working in areas, you may be working on the side of a highway, you may be working in torrential rain. There could be a situation where this is a plane crash, or multiple motor vehicle accident in snowy conditions. This could be a school shooting, a college shooting. So this could be anything that you are responding to. So I think working in those kind of conditions really requires a lot of resilience and a lot of mental resilience. Remember that anxiety is highly contagious, so you have to be calm, you have to be the voice of reason. And that's why that 3 to 5 years working with very, very unstable, critically ill patients, being able to work with some of those challenging patients, I think is going to be critically important, because that's going to help you to sort of calm yourself down. Even now, going out to a trauma scene, the adrenaline is still going. It doesn't matter how many times you've done it, because no two cases are the same. You never know what you're going to get. You have to find a way to bring your blood pressure down, to bring your heart rate down, to be able to, so that by the time you land, that you are in control of your own vital signs, you're in control of your own emotions, because somebody is really counting on you to have a very clear head, and not just you, but the rest of the team is counting on you to have a clear head and be able to make those decisions.
Wow, yeah, so you mentioned a lot of great things in what you just said. A few things that you mentioned, you talked about the rigor and the preparation, but another thing I want to speak on that you spoke of was taking care of yourself and having resilience.
Yes.
So when it comes to taking care of yourself, can you talk about how the work-life balance is being a flight nurse?
When taking care of yourself?
Yeah, like taking care of yourself, like how is the work-life balance? Being at work, you're on your feet, you're constantly having to make quick decisions, but once you finish your job and you go home, you have to take all of that off. So how is that balance between on and off the clock, and then are you able to balance other things outside of work, in addition to nursing? So
yeah, and this is a great question, and not just for flight trauma nursing, but this is a great question that all nurses, I think we have to really find ways to be reflective. So the great thing, again, I talked earlier about this team bond that we have, and so after every case is difficult, and every case is very, very challenging. I've never had an easy case, and we come back and we're exhausted, and it may be that we have to go back out again, within 30 minutes, because we never know what call is coming in. We're generally responding to the most critical cases, or it could be a rural case, something that's occurred in a rural area, so which may be a little bit calmer, but but most of this is trauma. We lose a lot of patients, unfortunately. So I think with this team, and I've found this in psychiatry, working as a psych nurse practitioner, also I found this working in the ER and in critical care, is that relies on each other, so before getting in your car at the end of a shift, just having a quick chat with everybody else. And just in trauma nursing, the team will often do a debrief, we'll just, what was the best part of today? What was the worst part of today? Sometimes we'll go home and think, how could we have done things differently? So we may bring that to the next time we come, but we won't do that at the time. So I think for all nurses, we sort of think, what could we have done differently? Had we done something differently, could we have saved the patient? It's always difficult to know that. I think when you get in your car at the end of a shift, it's driving home and thinking, I did the best I could. And every day that you go into work, you have to go in there with that mindset. You leave your ego at the door, you leave your anxiety at the door, you leave all of your nervousness at the door. The only thing that you bring in are your skills, your motivation, and your determination that today is going to be the best day. Whatever happened yesterday is gone, and today is going to be the best day. And it's kind of just asking yourself, did I do everything that I could possibly do for this patient? So I think mentally, my answer to that is always yes, because you show up and you bring everything you've got. And it doesn't matter where you're working, you come in. It's a little bit like being a student at GW School of Nursing. You show up for class, and it may be the class that you've been dreading, or it may be I have no interest in this, I'm not going to do that kind of nursing, why do I want to do it? You show up because you think you never know I had no interest in labor and delivery, and yet I've delivered over 200 babies.
Wow.
So, and yet that was the one class that I really didn't enjoy. Pediatrics, I thought, I'm not going to be a pediatric nurse, and yet I've taken care of more children than ever. It's another part of being a flight trauma nurse, is that you have to be able to take care of newborns all the way through to maybe a 100-year-old patient,
Wow.
is having a problem. So you're taking care of everybody. So everything that you learn in nursing school is going to apply. It's not all about can't wait to get in the ER and start saving lives. This is really about, learning everything from every instructor, from every guest speaker who's coming in, from every video you watch, every textbook that you open, is showing up 100% for it. So I think that way you can say, I gave it everything I've got. So if you get a bad grade on a test, it's like, I prepared to the best of my ability. I showed up, I did the best job I could possibly do. Sometimes things don't go as planned, that's life. But I showed up and I did everything that I could. And it's kind of a little bit like that with flight trauma nursing. We're going to lose a lot of patients, but I can drive home and know that I did the absolute best that I could. I have to accept that I can't save everyone.
Yeah, that's really good, and it made me think about one of the times that my mom was caring for a sick relative, and she was told that at the end of the day, no matter what happened, be comfortable with knowing that you did everything that you could.
Yes.
And that's really important for us as nurses to know, and to be aware of. So as we kind of reel all of this in and bring everything to the close, we talked about the rigor, we talked about having an open mind, we talked about preparing yourself by taking on those hard cases. Let's think about outside of the rigor, once you're becoming a flight nurse, what's something fun or interesting that a lot of people would not expect that you may have experienced or witnessed being a flight nurse?
I was hoping you were going to ask me that question, because what really shocked me was how much aviation knowledge you have to have. So it's not just the nursing knowledge, that you have to bring to the table, but you really have to understand a lot about aviation. So I think that was something. There is a certified, it's the CFRN, so Certified Flight Registered Nurse Certification. So this is a certification that you can take. It costs about $400. It's a 3-hour exam. And I think what's very surprising about that exam is how many questions there are on, not only on trauma and how to stabilize patients, and about the nursing care and triage and how to stable patients with respiratory problems, cardiac problems, trauma problems, but also on aviation safety. You really have to understand that in flight trauma nursing, safety is never compromised. No matter how urgent the call, no matter how much of a disaster you are responding to, we always take the time to do a safety check. That is first and foremost. So just like aviation safety, even if a flight, United Airlines is running an hour behind, and you're like, let's just get off the runway and get going to wherever we're going. Same with flight nursing, we all have to take that time to double check, not only aviation safety, so we have to have a vehicle, so a small plane or a helicopter that will get us to where we're going. So we want the patient to be safe, but the team also has to be safe. So there are multiple checks that has to be done. So that was a huge surprise to me, because I thought, this is just about all of my skills and knowledge as a nurse, but aviation safety is a big part of that. And so safety is never ever compromised. I think the other things is, I think how independent the role is. So it's a very independent role. I was very used to working in the emergency department and having all of these resources. Everybody was just at the end of a call, or somebody was at next door, or somebody was behind the nurse's station. Plenty of people to reach out to. Everything I wanted or needed in terms of equipment, medical supplies, or just to have somebody come and look at my patient to tell me what they think. All of that was very available, but now it's very independent. Myself, a paramedic, and a pilot. So, and I may be the team leader on that actual flight. So, and if I'm the team leader, then, they are looking to me, to be able to answer. So I think it's great to have all of the knowledge and all of that skills, but I would say if you think about flight nursing, if you have a chance to get involved in leadership, and you're involved with the SNA leadership, so, which is great, and once you get into your first job, to volunteer to be the charge nurse or try to make it up to being that charge nurse, that just so you get familiar with being able to come up with solutions to problems. Because the more you can do that, the more comfortable you'll feel with uncomfortable situations. It's like, I don't know what to do, or I don't have the piece of equipment that I really need to care for this patient. But you are able then to come up with a plan very, very quickly, to think on your feet and come up with a solution to that. So when you don't have the resources, you don't have the equipment, and you don't have maybe a physician standing there, you have to make those decisions independently. And I think that surprised me a little bit. And I think also the downtime, when, like I mentioned earlier, depending, it could be very busy, but we're not going to be on 150 calls, so we can't do that. So I think 6 calls in a 12-hour shift is probably the most that I've done. So there's a lot of downtime between, the sort of sitting, waiting, and I think, I'm not used to that as an ER nurse. We're used to moving constantly, I'm kind of running in circles for 12 hours. But here, that's downtime, but also the downtime is not relaxing time. You may lay down on a bed, because usually on a 12 or 16-hour shift we can sleep. We're generally not working in the ER. So you can lay down and sort of rest for a little bit, but you're never resting. As I say, within a minute or within minutes, you have to be up and ready, and you have to be in the air within minutes. So, or at least on the flight pad within minutes, doing the safety check and then taking off. So you never, I think, getting used to that also, of never feeling really relaxed. But when you get there, you have to be comfortable with feeling uncomfortable, that these are very uncomfortable situations at times. Be prepared to lose your hearing. So, as many of you who know, who have me as an instructor, that you have a lot of safety equipment with you, you have ear protectors, but that's not uncommon, to have this sort of long-term effects. Just like being a nurse, eventually you're going to have a bad back, even when you're using the best body mechanics possible. But constantly listening to the sound of rotators on a helicopter, it's extremely noisy in there, and you're taking that protective gear off every now and again. So I think hearing loss is one of the most common problems. But nothing will stop somebody. At some point you get to a certain age where you do have to, sort of step back from it, because again, it's very, very physically demanding. You can keep yourself fit by with a lot of strength training, with running, but eventually, this will catch up with you physically as well as emotionally. And then there are other areas of nursing, that maybe will really welcome those skills that you had as a flight nurse.
Wow, that was some really good information. And while you were talking, I actually thought one of the jobs I work in, one of the things they said was that we don't run from change, we run towards it. And you were making a lot of mentions of taking on, those type of responsibilities, taking on things that people don't want to do.
Yeah.
And even with the aviation, having that aviation knowledge as a nurse is so rich, because a lot of people would never think going into flight nursing, I need to know something about planes. So but with all of that being said, Dr. Lang, I want to thank you so much for taking this opportunity to speak with me and to share, with everybody about flight nursing, what it takes, how to be successful, what to expect, and just give a lot of baseline information. But as we come to a close, is there anything you would like to leave those who are watching? Any type of information, advice, or anything?
Yeah, I think the probably the words of wisdom would be, if flight nursing is your passion, if this is what lights the fire inside of you, don't think I have to maybe work as a med-surg nurse for 5 years. You know, just say, keep your eye on the prize, and this is what I want to do. So, you know, go directly into the ICU, go directly into emergency nursing, otherwise it's going to take you much longer. So if you think that you have to do 2 or 3 years as a medical surgical nurse, then do 2 or 3 years as an ICU nurse or an ER nurse. It doesn't have to be that. If you've got your mindset on doing flight trauma nursing, go directly from nursing school into the emergency room, go into critical care, and again, volunteer. The words of wisdom would be ask lots of questions, volunteer for the most challenging, difficult patients, or if there's somebody comes in and somebody else is taking care of that patient, go in, observe, ask questions, see as much as you can see, and don't be discouraged. I've talked how difficult the interview can be, and that 3-hour, the certified flight RN is very, very challenging. It's 180 questions, 3 hours long. We'll ask a lot about aviation, which you might be surprised at. But you know, I think just to really keep your eye on the prize. If that's something that you really want to do, it's very doable. And you will be the happiest when you are doing something that you feel is really meaningful. And again, when you are working as a flight nurse, you are working with patients on the worst day of their life. When you're working in the emergency room, potentially the worst day of their lives too. So what you can give as a nurse, your compassion, your knowledge, your skills, all of that, your critical thinking, your engagement, your passion, that's all you really need.
Wow, that's amazing. And first of all, really inspiring. I feel a lot better to go into my journey, especially with clinical. So I want to thank you so much. And I want to thank you all for watching. And stay tuned in for another interview we have coming up. And we want to thank you again, Dr. Lange. It was nice speaking with you.
Yeah, delighted. My pleasure.